Hospice. What is hospice? Hospice is care to promote comfort to a person when a cure is no longer possible for them. It's an agency that they can hire to help them be comfortable. Hospice cares for the families and the patient and identifies their needs during this time, their physical, social, emotional, and spiritual needs. You're eligible for hospice if you have 6 months or less to live, some sort of a life-limiting disease. Anyone. Hospice is paid for by Medicare, medical assistance, and most insurances will pay for hospice. It's provided regardless of your ability to pay, and it does not discriminate. Hospice care teams consist of doctors, social workers, nurses, anybody in the health field, and volunteers. There are 4 levels of hospice. The routine, meaning your routine care is respite. You're going to need more care because you're unable to care for yourself. General inpatient hospice, somebody who is in a nursing home or hospital that is having hospice care. And then continuous hours. What that usually involves is a volunteer who's sitting with the resident 24/7. If you feel a resident is in need for hospice, call for consultation visit. We are involved with Redwood Falls, New Ulm, what's that place? La Crosse, some other hospices in the area. The nursing department will know. The hospice patient bill of right. They will receive a bill of rights. It will be explained to them. They'll be told of changes in their care plan as it happens. They have the right to refuse and treatment and services. They'll be told about that. They'll know their limits of their service and payment, their privacy of their medical and financial information. They'll know how to access their records if they want to. They know they'll be served by trained people and how to voice grievances and how to complain, and be free from physical and verbal abuse. And they'll be given advance notice of any service changes and have their pain managed. Communication between hospice and long-term employees is vital. Medicare requires information for the facility about education on hospice. This is why you're listening to this, that they have 24-hour contact, identification of the care team members, a copy of a signed election form, the physician certification, recertification forms, identifications of medications covered by hospice, and copy of the physician orders to have the resident on hospice. They also need to have the hospice visit schedule, documentation of the visits, and the most recent plan of care and any kind of advanced directives. Statistics show that most nursing home residents do not want to be moved from their nursing home. So they'll have hospice at the nursing home. Both families and residents are more comfortable around the nursing home staff. Hospice can help the nursing home do the MDS reporting, which is how they figure how we are reimbursed. Terminal stages of life. Observation from 1 to 3 months before death. Usually you'll note that people are not eating as much, they're sleeping more, and they may be more withdrawn and lost in their thoughts. 1 to 2 weeks before death, they may be increasingly restless and agitated. They may be more confused about time and place. They may have difficulty identifying people that they should know. They may have visions of things around them that no one else can see, and they could be incontinent of urine and stool. Observation days or hours prior to death. They could have moist sounding breathing. They could have difficulty clearing their throat. Their breathing patterns can change. And the last sense that disappears is hearing. So you may think they're not hearing you talk, but they could be, even if their eyes are not open and they're not moving in any way. They could have changes in their skin color from pale to blue to red or purple, or something called mottling, which is blotches of red and blue, and usually it starts from the feet and works up the leg. They could have fevers. They could have a change in energy, appearing to wake up and may request to eat, but this is usually short-lived. Grief. What's grief? There is no right way to grieve. Grief is the normal process of reacting to loss. Normal grieving responses, you might feel numb, you just can't feel anything, you can't identify a feeling that you have. You could be in shock, sad, you might feel lonely and empty, you might feel guilty that you should have done something that you didn't, you just may regret not doing something. And then you may feel relief because the person was struggling so much. Spiritually dealing with grief, you may find meaning in the loss. You may be able to give or receive forgiveness, and you may feel more spiritually connected. Physical responses to grief, you may eat, sleep too much or too little. You may be tired and restless. You may have stomach aches, headaches, any kind of body aches. You may withdraw from family and friends and social activities. Cognitively, you may have trouble concentrating, very fuzzy, disorganized thinking, and you may be preoccupied with the person who just passed. You can experience grief or loss here in the workplace because you are connected to the family. Hospices have groups for families or staff, so tell your supervisor if you would like to go to a hospice group for staff to deal with a loss. How long does grief last? Grief lasts until we learn to live with our loss. Grief is like a roller coaster. One day, I'm dealing well with this, and the next day you're not. We must grieve. We can't avoid it. Time does lessen grief, but it doesn't mean we have forgotten or stopped loving the person who died. Help with grief? It helps to grieve if you acknowledge you're grieving. You take it easy on yourself. Don't be upset that you're taking a while to get over things. Don't judge other people who are need more time to get over something that happened than you do. Communicate what you're feeling with others. Sometimes it helps to reminisce about the person who passed away. It's helpful to attend memorials and events at your facility and try to have a balance of home, play, work, and rest. If needed, seek spiritual help or a grief support group that I said hospice has. And again, we will contact the hospice bereavement coordinator for staff here. And also you could have family do that as well. Grief is a journey we must go through, but we don't have to go through it alone.